Hi, Kristen. Welcome to the Mind Talk podcast. Can you introduce yourself for our audience, please?
Yeah, my name is Kristen Carusos. I'm founder of CrossGen Health. CrossGen Health is a consultancy that works with adult children and aging parents to help consolidate health data and create sort of an aging and caregiving roadmap for adult children for their aging parents.
So, you work with aging, caregiving, and basically family health conversations that I don't think
Yeah.
anybody in Asia wants to talk about. So, what prompted you to start this?
So I think I'd always been really passionate about preventive health.
Mm,
And I was going around and I was going to these events and I was kind of sharing my own sort of like frustration. I was like, oh gosh, we can't get these like, I feel like these baby boomers are not like, they won't eat vegetables or getting the exercise. And that was kind of the internal kernel of it. And then, I was thinking about caregiving and how prepared adult children are, especially people in their 30s and 40s and 50s, how prepared they are for caregiving for their parents. So then I went to the market and I actually did a survey last summer about 100 people,
mm,
mostly located in Hong Kong and their parents in Hong Kong, but some people like they're, from India and they live in Hong Kong and their parents are here, or their parents are in India or in Malaysia or in China. That was, the most sort of like I would say, yeah, I would mostly say like Hong Kongers, mainland Chinese people, and Indian people who live here and abroad were the most like the biggest target sample. And I asked them, and I just sort of realized that there was a big gap between what people actually understood about their parents' health, how prepared they were for caregiving, what information that they had, what information that they didn't know, what the anxieties around aging parents was. So then after doing that, I sort of set up a consultancy around giving people that information and giving them an aging and caregiving roadmap. So after I speak with them on one session that I have, they kind of come out of it knowing what they need, what documents they need to get, what conversations they need to have, not just with their parents, but also with their spouse, with their siblings, like even things like, is their house elderly friendly? Like is even something as small as like, is there a bath mat, slip-proof bath mat in the
mm.
shower? Is there a handrail? Because falls create a lot of issues for people over 65 if they, especially if they have osteoporosis or sarcopenia or something like that, where at fall can actually have a huge impact on their overall quality of life.
So, Kristen, I think what you're saying became quite relevant to me. Actually, I've been following your Instagram channel, and
Mm,
everything that you talk about there makes so much sense to me. But it wasn't really connecting with me until
mm,
recently. My daughter had come over for Christmas holidays, and she said to me, "Mom, why do you look like shit every night?" And I said to her, because I get tired after a whole days of work, And she said, "But
mm,
you didn't look like that before." I said, when? Like 10 years ago, 15 years ago, I was also much younger. So, and
mm,
in that moment, she said to me, "Mom, I really worry for your health." And
mm,
suddenly, that was an aha moment. I was like, okay, this is what you're talking about on your Instagram. So, what I'm really asking you is, has there been any such moment in your life where you said, this needs its own consultancy? This is what is the need of the hour? Because there are so many caregiving platforms. And what is
mm.
really your experience in creating
Yeah.
this?
Yeah, I also think something like it kind of started with my dad first, but
Mm,
actually with my mom's experience of taking care of her, like her mother when she had dementia. And it started when actually she used to live in North Carolina and we used to live in Georgia, which is in different states. And one time we used to go visit her once a year. And there was one time we went for lunch and like, we caught up with her, we go and see her for a week, and she was repeating herself every 15 minutes. And this is like within a year's difference, right? So we found out that she had had a stroke. And at first, it was actually, we're like, oh, she repeats herself. That's funny. You already asked that. But then after an hour lunch, we're like, I think I was 14 or 15, and we're like, we need to go and get her tested. And I think for my mom, she didn't have a will, she didn't have power of attorney, she didn't have all these documents. And like dementia is not a quick disease, it's not a heart attack. I think from that lunch to when she actually passed was 5 or 6 years. And this is going through the different stages of dementia. We eventually had to move her down. I'm not saying that every parent is going to have dementia, but I think that a lot of the strife and the difficulty of it was like that we like they never talked about it before, that they had, there's no power of attorney. There's like all like we had to take away the keys and the car and the credit cards and like everything. The mortgage had to be in my mom's name. There's a lot of difficulty that comes in these decisions when they're like reactive, when you're like, oh my gosh, who, like we live in Georgia, she lives in North Carolina. Who's her doctors? What's her insurance policy? How does her insurance policy cover this? So I think that there are caregiver platforms, which I recommend, but I would even say I'm before that stage. Like I'm thinking about risk and time and energy and how to plan like the next 5 to 10 years, 20 years with your aging parents and with your kids and how you can sort of prepare for that before all of these things happen. So that it's not like you're getting hit, like by a tsunami wave of all this information, all these things to do. I just want that process of people's parents aging and them caregiving to be a lot more smoother and a lot more stressful. And I'm not saying that like caring for dementia people isn't going to be stressful, but there's ways in which you can have the documentation, have the conversations with your parents when they're clear-headed, they don't have cognitive decline, and they're in generally good health.
I'm really sorry to hear about your mother, but then what you
Oh,
said
so it's my
also
grandma and my mom, yeah.
is sorry
Yeah.
about that. Uh, but what you really said that stayed with me was these are the conversations that you didn't have, one.
Mhm.
And secondly, and this is what I want to focus on, is y- your consultancy comes before caregiving. So it comes at a time when you're not really thinking about caregiving, when you're not really in that space, because you're saying by then, you're struggling to see where all the documents are. Like you said, the keys, the
Yeah.
power of attorney, all of that. So when
Mm.
is the right time for everyone to start having these conversations?
I mean, I think the sooner the better. I heard this quote from this caregiving book that I was reading, and it was saying, like, it always feels like it's too soon until it's too late. And the
Mhm.
best time is that when there's not anxiety around it. And don't do it at Christmas or Chinese New Year or Diwali. Do it at like a non-stressful time, non-holiday time. And I think even like, my series on questions to ask your aging parents. That's not like the first question isn't like, what happens if you get dementia? That's not the first question. But I
Mm.
actually think people should try to build relationships with their parents, ask them questions about their lives, get to know them more. And the purpose of that is obviously to build a relationship, but also to make harder conversations like a lot easier and a lot smoother as they get older. I think, when they're not sick and when there's not anxiety around it, is the best time to discuss it, to be honest. When you don't have that pressure, when everything is more relaxed and more calm. I talk to my dad now and I can be like, Dad, like, you're so far away from this happening, but it's good for me to know your end of life wishes, your funeral wishes. What happens if you get really sick? You're really far away, but like it's better for us to know now so it's less of a problem as you get older. And I would say the siblings and the spouse, those conversations are important as well, as I said before. Who's like, what sibling is going to do what? Who's going to fly to where? Who's going to take the parent to the hospital? Who's going to deal with some of the admin or the finances or sitting the caregiver? And when it comes to two spouses, what if someone's family gets sick and how are we going to support each other during that process? So I think, the sooner the better for these types of conversations. And I actually think about, that's about caregiving and support, but also about health history. I mean, for my family, when I ask my whole family, there's a lot of question, like everyone has heart disease. So what does that mean for me? I'm in my 30s. It means that I need to make sure that my cholesterol is good. I need to maybe be getting the sort of like ECG to make sure that like my heart has a normal heart rate. And I need to be really conscious about how, from right now in my 30s, I can have heart health throughout my life if I know that this is a pre-existing condition in my family. So it's not just about what you're going to be doing for caregiving, but understanding their medical history helps you understand what you should do to have good health throughout your life. And you'd be surprised. You'd think, oh, maybe people talk about this, right? And I think, I'm seeing a lot of things like glaucoma or autoimmune diseases, or even like my own, mom, she did IVF. And I was like, wait, you did IVF? And she's like, yeah, for like 5 years. And I was like, oh, that's new information for me. So I think that all of these conversations, like there's more transparency and things that you can take forward and think about for yourself as well.
Mhm. So you talk about having these difficult conversations, and not about big things, but more about like even small things, right? Like
Mm,
your glucose levels are high, or you're making
yeah,
doctor's trips. Where are these documents and all of that?
yeah,
So, my question to you is, what is misunderstood about caregiving in Asia? Because your platform is focusing on Asia, right? Not just Hong Kong.
yeah. I mean, I think one is that you can just like hire a helper. Like, you know, you can hire a helper. That's one. Like, oh, I'll just hire a helper. It's fine. And I
Mm,
think that does help. Sure. Like in the beginning, like right now, in their 60s and 70s, someone to help them clean and do grocery shopping and maybe take them like, you know, take them to different places. But like that's not the same as having like a stroke nurse or like having to have actually a full-time caregiver at some, you know, live in or something like that. You need to think about different places, like in different phases of that your parents aging that you have different resources for and how you have to build them up. So I
mm,
think it's like, and like another is that like it's just money, right? I can pay for it. I have enough money. I can pay for this. And even if you can pay for that stroke nurse, it's also energy and time and like in having conversations about like how much money do you have for retirement? What are your current insurance plans? These different things like that. And you know, when you don't have kids and you're thinking about your future, you're not thinking about maybe if I have kids and I'm raising my kids and then I'm also having to take care of my parents, like how am I going to manage my time? If
mm,
something happens, how am I going to adjust my work schedule? And I think actually it's also number two, it's in the specifics. Because I talk to a lot of people and they're like, Kristen, like I'm Chinese. Of course I'm going to take care of my parents. I was like, that's so great. What does that mean? Like, what does it actually mean from like money, time, energy? What does that actually mean? Caregiving. So how do you define that and how is that actually going to play out in the future? And thinking about how you can adjust that into your life is also sort of a misconception. It's like it's just a vague promise if you don't have concrete details of what it actually means.
mm. You spoke right now about your experience where your mom told you that she had IVF for 5 years, and you're like, this is
Yeah.
news to me.
Yeah.
So what makes it's so difficult for parents to share their medical history with their children
Mm.
or even talk about it?
Yeah, I think that there's two ways that I have found are more successful for having those conversations.
Mm,
One, centering it around yourself. Like you're actually saying to you're not saying to your mom, what's your health? What's your diabetes? What's this? Like that is going to put up walls fast. But if you make it about yourself, like, hey, I'm actually thinking about my own like health and what I can do to prevent diseases. Can you tell me a little bit of our family history so I know what I can do for checkups,
mm,
for like, you know, do we have if we have breast cancer in the family? I think that will be talked about breast cancer because it's such a big one. But if there's breast cancer in the family, like I need to know that I need to be getting mammograms and understanding what diseases have genetic components to them is
mm,
also helpful. I think a second one is grandparents, right? Because then it's not about them. It's about what was it like seeing your grandparents, you know, like my grandparents, their parents getting older.
mm.
And when I talked to my dad about this, my dad told me that he used to go to Braves games, which is like a baseball team
Okay.
in the US. Like they used to go to Braves games like all the time. They had season tickets and it just became untenable for my grandfather when he was in his 1970s. And I was like, and you can ask something like, how do you want to age different than your parents? How do
Mm.
you want things to be different? Rather than it being so late on you and you're not doing this and you're not doing enough and you're not doing this, I think at bringing it to yourself or talking about your grandparents, like what was that like for you? And it doesn't have to be like, what was it like with their grandma's dementia? Like it doesn't
Yeah.
have to go there, but those conversations can lead in by like, what was that experience like for you? You know, like what are your memories about your parents? And like, how did you want to be a different parent than your parents were to you? Like these kinds of things are more like, yeah, less defensive. And it lets people kind of actually tell their stories and talk about different things and learn different things about them, which again, like the more that you build that relationship, the easier difficult conversations are.
So taking a more collaborative approach, so your parents
Mm,
don't think you're nagging them about their
yeah.
health and things like that.
Yeah, and I also think that when I talk to a lot of people, I think people sometimes laser in on what their parents aren't doing right. You know, like they're not eating healthy enough. They're not like they should be doing this and be doing that. And like no one likes to be nagged. I don't like to be nagged, you know, like I don't like to be. And I think the more research that I did and the more books that I read, it's like your parents, you're not parenting your children. I mean, so you're not parenting
Respecting
your
your
parents. They're
parents.
not
Yeah.
children. Like you know, like you need to treat them with respect and like think about what really
Mhm.
matters to them. And I think sometimes people, you know, I talk to people about their parents and their habits all the time. And I think people need to kind of like take a look at what they're actually doing right sometimes. You
Mm.
know, if your parents are have lots of hobbies and lots of interests and like love playing music and have things that they really enjoy doing, like that is great. And like you shouldn't underestimate the value and people feeling like they have a purpose in things that they enjoy. Or they eat an all vegetarian diet with lots of beans and lots of tofu and like, you know, they have a really good diet and they're really health conscious about what they eat and like making sure they're getting all their macronutrients, or they spend time with the grandkids, or they have lots of friends and lots of social events and they like spending time with people. And I think that these things are kind of undervalued. I mean, obviously, yeah, do your you know your checkups,
Yeah.
do your colonoscopy, your prostate exams, your breast exams. Those are all important. Eat healthy, sleep, diet, everything like that. But social health is also really valuable in longevity and people's like happiness. And I don't know if you heard about the sort of like the 85-year-old happiness study from
Oh,
Harvard.
tell me about it.
Okay, so it's like the longest longevity study that they did, and I can send you the link for it. And they look at like over 85 years, you know, asking different people what makes them happy. And it's not money, it's not like fame or success, it's actually just like who's in their social network, you
Mm.
know, what the depth of their social relationships are. You know, do you have close, meaningful relationships? Do you have lots of friends? Do you have a good spouse? Do you have a good relationship with your children? In these relationships, like the depth and the meaningfulness of them sort of equate to people's long-term happiness.
Mm.
Yeah. So it's a long study. It's like it's not just like 1 year, it's like 85 years they've been doing this study. Um, so it's really interesting.
You
Does that
mentioned,
surprise you? I probably not, right?
sorry, go ahead.
Does that surprise you or probably not?
So I actually look at happiness very different, and yes, these are some aspects of happiness. For me,
Mm,
happiness comes more internally. You know,
yeah.
you cannot chase happiness through friends, through this or anything else. Happiness
Mm,
comes, when you have purpose. And the moment you have purpose, you will see that you align with everything else. You align with
mm,
better habits. You align with the right people who end up becoming your friends. And because you're happy internally, you wake up in the
yeah.
morning and you have something to look forward to. So I work on the podcast, the Mind Talk, building a membership platform. I was telling
Yeah.
my friend the other day, I said, every cell in my body vibrates at such a high frequency. I can feel joy in me and love in me for everyone because
Mm,
this, I have a purpose.
yeah.
I mean,
Yeah,
that's how I look at joy
that,
and
but that's definitely like, that's definitely in the research as well, right? You know,
mm,
I think I just like in my recent Substack, I mentioned a book that I would definitely recommend. It's called Secrets of Women's Healthy Aging, and
okay.
it's from Monash University in Australia,
Mm-hmm.
and they did this study from like I think it started with 2,000 women from the 1990s to now. It's like a longevity study, so they check in with them every year, and having purpose, having an optimistic outlook on things were some of the things that drove people's like long-term fulfillment. And also like it's not just like, you know, mental health wise, but it's also physical health wise. Like they were living longer when they felt like they had a purpose. And when
Mm-hmm.
they woke up every day being like, today's gonna be better, everything is gonna work out. You know, it's not just like, I'm not saying that mental health and physical health are obviously have a huge, you know, there's a huge overlap for how those two things work, the mind body connection and
Absolutely. Yeah.
everything. But I think that there's actually really like sort of hard science to back this up as well.
True, true. You spoke about this entire thing about nagging, right? How children are like,
Mhm.
give me this, where is this, all of that. I love
Yeah.
how you said it. Uh, what are children really worried about? Because that nagging comes from the same space as when parents nag their children, right? And now
Yeah.
we nag our parents, and it comes from a sense of care and fear for their well-being.
Mm,
So what are some of the things, because you've done the research, what are some of
yeah.
the things that you would say are the topmost where kids worry for their parents' well-being?
I mean, I think that there's a few different elements of it, right? I think that they see habits that maybe be like are unhealthy habits, and they're thinking, okay, like, well, what is their quality of life going to be in 5, 10 years? Is this gonna, is their, if their cholesterol is high,
Mm,
is, or their blood pressure is high, is that going to lead to diabetes? If their blood sugar is at that level where it's getting close to diabetes, are they going to have more complications? They also, generally want their parents to be happy and in good shape and don't want them to have mobility issues. Or I think there's also concerns about like, at what point am I going to have to take care of them? But I haven't spoken about it. But it's like in the back of my head that I know that like if they continue with these types of behaviors, I'm going to have to take care of them or I'm going to have to do that. And like there are like obviously there's like more altruistic interpretations of that, right? I want my parents to be happy. I want them to
true.
do well. I don't want them to suffer, but also thinking about like how will I take care of them given everything I have on my plate, especially in Hong Kong where everyone's like slammed busy and like always on the go and always like on to the next one. So I think that that's something that's a consideration as well. It's like, what's their quality of life going to be, and how is that going to impact me and what I have to do for them as well.
So also you spoke about talking about money and illnesses and end of
Yeah.
life wishes. Now,
Mm,
this is not something that comes easily, I think, to Asians. Like even as an Indian person growing
mm,
up, I was always told about, okay, don't talk about death all the time,
yeah.
right? So how do these cultural values impact these conversations?
Yeah, I mean, I think this is like I would probably have all of the conversations that I've had first and then go into them. They're very sensitive, right? People
Mm,
don't like talking about people. I think, from what I can understand about parents, parents do not want to be a burden to their kids. Like you talk like that is across across like different cultures. No one wants to burn their kids. They don't want to put anything on there. I think I mean, this is kind of it's kind of a weird analogy, but I sort of see it like when they teach abstinence only education in schools. Like they say no sex education, just abstinence. It doesn't change the fact that these things exist or happening. Just
mm,
because you don't talk about something doesn't mean it's not a problem. With financial issues, I feel that people at some point, once they have built the relationship around these other topics, you cannot go in straight with this. It's like, what is your retirement? How much do I, like, do I need to contribute? Should I be planning for that? Again, sort of bringing it back to yourself. Like, I just want to do my financial planning in a way that if I have to support you, that I understand how to do that. But these are tricky conversations. A lot of people don't want to, a lot of parents don't want their kids to know maybe how much they have, how much they don't
mhm,
have. They might be in their will. So it's actually very tricky. So I'm
mm,
actually not doing the financial discussions. I'm kind of letting kids know that they should understand how much their parents have for retirement, or if they're going to need the cost of these different things like nursing homes or different things like that. Because from a lot of the dementia research that I've done, if they have dementia at some point, there
mm.
will be a point when they cannot live at home, or it's just untenable or really difficult for them to live at home without a 24-hour sort of nurse at
Right.
the later stages of the later years. So it is very tricky. I think, but you do need to know, right? You need to know if they have enough money for this, or if they planned for these types of things, come like worst comes to worst. But it's not an easy problem to solve.
It is, yeah.
Um, and I think sometimes this is not a optimistic reading on this. I think that parents there's a weird feeling around talking about money when
Mm,
it comes to inheritances and how much money the parents have, how much the kids will get.
mm,
And I think that's why it's really important for parents to have very clear wills.
mm.
Because when I talked to lawyers, they said no one goes for blood quite like siblings, which is like very alarming to hear, right? So
No,
having
not
making sure
really.
I mean, it makes sense, right? Like,
Yeah.
nothing tears families apart more than like contesting wills and that not being clear and transparent. And I think some of that can be like, we don't want to have conflicts in the future. Like
Mm.
setting this up and communicating this clearly to us makes it so these conflicts won't happen after you pass, which is, of course, not what you want. But the money and the finance, like even financial advisors and lawyers are like, we don't know how to mediate some of these conflicts. So I don't think it's, again, I'm not a lawyer or a financial advisor. So I think just having building the relationship with different members of your family also help. But I understand it can be difficult depending on each family. Not every family gets along so well or so perfectly. Most families, to be honest.
Yes, because throughout the conversation, you've spoken about taking care of your parents, but also clearly identifying with siblings what roles they are going to play.
Mm, yeah.
And I also want to bring attention to the sandwich generation, which is caring for the
Yeah.
parents, also caring for the children. And do have you seen signs of burnout for them? Because it's a lot, right? To
Yeah,
bring
I
their
mean,
daily life.
caregiver burnout is huge. It's massive. I mean, that's why there's a company called Aging Well, and they deal with like managing caregivers, like the burden and working with different companies to help them prepare and give them resources for this. It's real, and it's kind of bringing back to why we want to prepare, why we want to have more lined up before we get to this stage, because it is quite a lot of burden. I mean, you have high rates of depression, you have high rates of anxiety. Unfortunately, a lot of the caregiving falls to women.
Mm,
And even when we talk about siblings, like there's usually a primary sibling that does most of the caregiving. Maybe it's like, one sibling who's here or like closer or more responsible, and even understanding the dynamics of what sibling, like what parent listens to what sibling the most, you
mm.
know? So I think that that's really driving a lot of my work as well. It's that they need to, it will be difficult. Obviously, caregiving is rewarding, taking care of your family is rewarding, but there is a lot of stress and things that you have to manage when you get to that stage.
You also mentioned previously that you were speaking to someone and they said, "Of course I'm Chinese. Of course I'm going to look after my parents."
Yeah.
So there's also almost like this cultural expectation that this is a done deal. I have to take look
Hmm.
after my parents. So how could it become more sustainable? How could that setup look? When is the right time to start these conversations? Can you talk a little about the documentation process which you recommend? And
Yeah.
what kind of systems can people put in place before they even get to the caregiving stage?
Yeah, so I think one of them is like the obvious ones, the legal and the financial documents, right?
Mm.
Power of attorney, having a will. In Hong Kong, there's like an advanced medical directive, which is like a do not resuscitate order. I
Okay.
mean, I think talking like having the medical history, eHealth, if they're using public healthcare system in Hong Kong, which a lot of older people are, connecting your eHealth to their eHealth, so you can actually see all of like not all, it's not a perfect system, it's still developing, but you can still get a better idea than you would have already had. And having a list of the insurers, having a list of the doctors, having a list, like, having the whole the medical records of everything that they've done consolidated in one place. So if you have to do something, if someone breaks a hip, then you already know what medications they're on, what allergies they have, that kind of stuff. And that's why I have like one of my sessions is I just sit with people and get their medical health record down. And I
Mm.
know you listen, you can go and do it. You don't have to pay me to do it. But most people don't. Most people put it off because it is very administrative. So I help sort of consolidate that for people because it's tedious. It takes an hour and we have to go through everything in detail. And then you have everything down. And then your parents have everything down. But that like you don't want, it's like, where's the medical records? What's their current conditions? Oh, they got the scan here. Oh, and I think a big challenge in Hong Kong as well is the fact that there's private and public. And sometimes, depending on the clinic, the private clinic, it can be difficult for you to get that information from the
Mm.
clinic. Each clinic is different. Some, like I go to Sharon Medical, shout out, they'll just send it to me. They'll be like, boop, 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 there you go. There's all your things. And I'm like, okay, great. Thank you so much. But other clinics, they're like, sorry, you have to come in and get it. Oh, actually, there's an administrative fee to like get your medical records out. Oh, for us to do this formally. So there's actually a bit of friction in getting all of that documentation if you haven't been getting it all along. I mean, what I would recommend if you're starting today is every time you go to the doctor, document it. Every time your parents go to the doctor, have a WhatsApp group where they're sending you all of those documents. You're maybe putting it into a drive.
Mm,
I have an Excel spreadsheet which is like goes through everything,
mm,
but I think that getting that data and having that data is really important.
So basically, making sure all the data is in one place to be shared. So WhatsApp
Yeah.
group is not just for good morning messages and jokes, but
Yeah, not just for
most
cat
importantly,
photos.
use it for this. So everything is in one
Yeah,
place.
yeah, totally,
Y-
totally.
You spoke about end of life topics, and that can
Mm.
be really difficult in some cultures.
I think most cultures,
Most
yeah.
cultures,
I
right?
know you're like, oh, she's American. They love talking about it. It's like, no, I think all like everyone, no one likes talking about their own death, you
Mm.
know?
I didn't mean it
Like,
like that, but it's coming from my own experience. I can't even
yeah,
broach these topics with anyone, and I don't like people broaching these topics with me with all my,
totally.
yeah, I'm so modern and so woke, but no, don't talk to me about death. And
Yeah, yeah, no, no.
something
And
gets triggered. So, what
yeah.
are the gentle entry points that we could broach? Because I don't know how one would start this conversation. So, Mom, what do you want for your end of life? That's a nice
Yeah,
conversation to have
I
over a
think
cup of tea.
that you can talk about, and I can actually send you like a document. There's this NGO, and it's called the Conversation Project,
Mm,
right? And it talks about like how you can like go in the different entry points to talking about these different types of like a cult, like these different types of topics around end of life. I mean, I think what matters to you when it comes to like, your health, and what matters to you when it comes to your quality of life. And there's a lot of questions about like, is it more important for you to live a long life? Is it
mhm,
more important for you to like stay where you live? Or like what, I don't think you have to talk about the funeral and like palliative care, which is like end of life care. I think you can talk about, what was it like toward like if their grandparents have passed away, what was it like before, your grandma, your grandfather passed away? And like what do you want that to be different? Again, grandparents are a really good entry point because it's not about you. It's not about what what you want in your death. It's about when you saw that happen, how do you want these things to be different for you? Or how do you want these things to be like, what do you see being in your 70s and 80s to be like? What does that look like to you? Rather than being like, what do you want me to wear at your funeral or something like that? You know what I mean? Something that's like not very tactful, right? So I think those kinds of conversations, again, there's ways of topics to bring it up and then bring it up at the end. I would never start any like, how much money do you have in the bank account? What's the funeral going to be like? Those are not good entry points into having open and vulnerable conversations, you know? So I think like again, now, you talk about when do we start? I think you can start having these conversations slowly with your parents about their lives and their expectations, what matters to them when it comes to their health, their quality of life, everything like that.
mm. You
Does
spoke
that make
about
sense?
the eHealth app by the
Mhm.
government.
Yeah.
What gaps do you see in Hong Kong's current support system for aging and caregiving?
Think a lot of the information is siloed. A
Uh-huh.
lot of the information is siloed. Like there is resources. I think for non-Chinese speaking, there's a lot of gaps, right?
Mm,
Most things are tailored towards, Canto speaking, maybe even Mandarin speaking, but mostly most of the documents are in Cantonese traditional Chinese, right?
right.
I think for non-Chinese speaking, I think there's a lot of gaps in actual resources.
Mm,
I think everything is all over the place, what you need. There's not really centralized places for things. So I'll give you an example, right? We talked about caregiving and helpers. So there's like a program that you can actually go and have your, like whatever helper you're using, trained to be more elderly compliant. But no one's ever heard of that, right? It's just like a small website, a small program that I found.
oh,
Everything is sort of all over the place. There are things for Hong Kong citizens like checkups, everything like that. There's even roadmaps on, what you should be doing for preventative aging. But I guess the public-private, the data gaps are there, and like how you can easily access your data
Mm.
and what to do with your health data is also a big problem, I think, in my opinion.
And what are some of the initiatives you spoke about health checkups? What are some of the initiatives or services that Hong Kong does do for caregiving and aging population?
For caregiving, not that much. That's why age well is so good and important. I believe there's vouchers for people who are living in Hong Kong over a certain age to go and get different services done, like dental or blood checkups. Some of the community centers have free checkups, but again, the elderly community centers are mostly in Cantonese. So like a lot of the services, a lot of the communities. There's actually this thing called, this is for like for mostly in Cantonese as well. There's this thing called Elderly Academy, which is really good if your parents are from Hong Kong and they speak Cantonese. It's like a platform where they can go and like learn different things and learn different skills. Obviously, this is very good. They can make friends. It's good for cognition. They can learn things like there's even stuff like how to do like trading or how to use AI or like little different things like that that are really interesting. Or how to do sewing, or there's so many different of these like elderly events. This is not a Hong Kong government one, but AIA has some AIA Carnival. They have some elderly silver workout classes, which
Mhm.
is good. I think some of the public healthcare stuff is there as well, but yeah, it's really siloed, as I said. I would say that that's a big problem. It's like, where's all this information? And that's actually when I do the aging and caregiving roadmap, I do curated resources of like what's available for this. Even like there's this company recently, I'm really impressed with them, so I'm going to shout them out. It's called Captain Soft Meal. So
Mhm.
they actually, at some Hong Kong restaurants, they do soft meals for people who have different problems like eating, swallowing, and they can't have hard food.
Okay.
And it gives them like there's like options at these restaurants for softer meals so
Mm.
that they can, even if they're older or in their 70s or 80s, they can still go out and eat like their favorite meals, but they're a bit softer and they're made for people who have issues eating.
Oh, that's brilliant.
Yeah, it's really good, right?
Listening to you is really just like opening a vault of information on caregiving and aging.
Yeah, thanks.
I'm
There's still so
really
much to
enjoying
learn,
this
but
conversation.
yeah,
Uh,
yeah.
and sorry, I lost my train of thought. Give me a second.
No, no, all good, all good. I
Sorry, yeah,
have,
this I was going to talk about this. So you talk about the English speaking population,
mm,
and a lot of them are expats. I think almost all of them are expats, majority.
yeah,
So how do you help them because their parents are in India, US, UK? Do you
yeah.
also go ahead and study those systems and those government setups as well?
Yeah, I mean, I think it's case by case. I'm not as able to give for the US market. I know a little bit better because I
Mm-hmm.
like there's my chart. Just a small thing. My chart, it's like it's a eHealth system,
Mm-hmm.
but every clinic system has a different eHealth, like a different my chart, and there's
Okay.
multiple different platforms, and then they don't like even if one clinic has my chart and another clinic has my chart,
Mm.
they're like they don't talk to it, they don't integrate. And I think that that's maybe a state thing because the US is so big, but you also need to use a VPN for that. So like knowing whether your parents' medical like platforms require a VPN or not is also like I'm finding that out slowly but surely. But I think it depends for expats whether they're an only child. If they're an only child, I think that there's more work for me to do because they will be responsible for their parents.
Mm.
But also I think it depends on how much they want to play a role in their parents' caregiving. And also yeah, I mean, like what they've talked to their parents about, what they haven't, even though there's like, they sort of like in the West or Asian cultures, I think each family is different. Some families have like talked about so much. I'm like, wow, like you've already paid for your own funeral. That's crazy. That's so good, or different things where they've never talked about anything. So I think there's definitely demand there as well. To know what you don't know and what you need to find out is definitely a service that I provide and like having a checklist. I think that I just know more about Hong Kong market because I've been doing research and I live here and I've been talking to people in Hong Kong. So yeah, I also help expats as well. And it's good to get their like even more of their medical record and talk to their parents about their medical conditions. Because unlike in Hong Kong, you're not seeing the parents every Sunday for a mahjong or a family dinner, right? So sometimes that decline can happen even faster because you're not actively watching it.
So going forward, what is your big vision for your company?
Yeah, great question. I mean, I want to help as many people as I can with their sort of caregiving and medical roadmap, but I'd also like to do, more B2B events. I'd like to eventually maybe branch out to some other things about financial and legal conversations and refer people to lawyers. I'm not a lawyer or a doctor. I'm just helping kind of consolidate that data and then having, recommending you different people that you can speak with even if it's like exercise physiologists. So I think for this year, I really just want to build, build my client base and work with more clients and also, talk to as many experts or doctors or anything as I can because those are the people who I actually lean on for the medical knowledge. I did a video with my friend who's an eye doctor about what eye conditions affect elderly populations and what eye conditions are genetic, like glaucoma, which has a large genetic component. So that's my vision, building it out, maybe doing more B2B events and helping larger groups of people with their caregiving roadmaps.
Mhm.
And yeah, so that's sort of what I look forward to. I think next year I'll try to build maybe a digital platform as well, but for now I'm just going to be doing the consulting work myself and maybe hiring someone later in the year.
Wishing you all the very best for the amazing work that you do, which is not
Yeah, thank you so
limited.
much. Thank you for your time and thank you for having me on your podcast.
Thank you so much.